East Texas Live on KETK. Well, we're a month out from school starting, but many teens are already beginning to practice for sports and getting injured.
Joining us to discuss sports injuries is Director of ETMC Urgent Care, Kelly Cox. Good morning.
Good morning. How are y'all today?
Good.
Doing well. So it's summertime. Kids are out there running around. Some of them are going to practice, getting ready for the fall. What sort of injuries are we seeing right now?
Well, initially, the first injuries, of course, with the heat being the way it is, hydration. I spoke on this a few weeks ago. Hydration is a big deal. They need to make sure that they're hydrated, not only for their vessels, but for their cells and their tissues, their tendons, their muscles. Additionally, I think the biggest problem that we have are the sprained ankles, the sprained knees, the the tendon injuries, the tendonitis, all of those things. Because
yeah, are there really ways you can prevent that then?
Absolutely.
Okay.
Especially the adolescent age, they are growing through such growth spurts that their bones sometimes are stretching their muscles to as far as they'll go. And so those muscle fibers are already stretched to an extent. Well, if they do a rapid sports action without stretching very, very well prior to performing the sports, that stretched fiber tears. And the best thing that they can do is continually stretch, and not just stretch at during the sporting events, but stretching at home and looking at things and ways on how to improve their flexibility. It'll decrease their injuries significantly.
And with some of these injuries, some parents might not think of them as a big deal.
Yes.
They might say, "Oh, just put some ice on it." Is that really the correct thing to do, or what should parents do?
One of the most common injuries that we have with sprained ankles, it may be what's called an avulsion fracture. Because the tissues are so strong and elastic in children and adolescents, the tendon can actually rip off a piece of the bone where it attaches to. Yeah, that sounds. I saw your face.
Really dramatic.
It sounds painful.
But it's true. It actually can take that piece of bone with it during the injury. So we go to the rest. You remember the RICE, rest, ice, compression, elevation when we treat injuries. If that's not working after a couple of days, or if the swelling or movement, mobility of the foot is impaired, then you really need to go into an urgent care or primary care for an x-ray of it, because that avulsion injury can be permanently limiting. And orthopedic surgeon can fix it quite easily. A lot of times it's just simple casting. So it's not always a horrible thing, but they go unnoticed quite often.
So what about us older folks? Should we be stretching as well? Or is...
There's a saying, I'm in my late 40s, so I have learned the saying that we're no longer elastic, we're more plastic. So
We're more plastic, okay.
we have a tendency to tear things or break things more than stretch things and strain things. So yes, as you get older, definitely stretching is probably the most important thing that we can do. A lot of times, even before you get out of bed, a good stretch can help. One condition that a lot of runners suffer from is plantar fasciitis, where the bottom of your foot becomes inflamed, and it's extremely painful. And the primary treatment of that is stretching before you even get out of bed, because
it's really as simple as that.
It's as simple as that.
Okay.
Well, thank you very much. Always useful information.
Absolutely. Well, thank y'all for having us.
Okay, well, coming up, McAllister's invites